Welcome to The Explainer. Today, we're diving into a story of just absolute unprecedented scale happening right now in the healthcare sector. We are breaking down a massive dual announcement from Apollo Hospitals, and it is honestly a perfect showcase of what happens when monumental corporate growth meets critical public infrastructure. We're going to zero in on a record-breaking surge in their revenue and exactly how this major healthcare provider plans to turn that massive financial windfall into a literally enormous expansion of real-world physical capacity. Let's get right into it. 7,043. We are talking about 7,043 crore in revenue. Now, you really have to pause and understand the sheer scale of the capital involved here. I mean, this isn't just some successful little balance sheet update. This 7,043 crore figure, it's the core catalyst for our entire discussion today. It's the absolute engine that makes literally every other piece of data we're about to explore possible. And here is exactly what that financial milestone turns into. 5,800. This is the tangible, physical output of all that financial success. We're talking about 5,800 brand new hospital beds being added to the Apollo network. The really crucial point here is that corporate success in healthcare isn't just about shareholder value, right? It ultimately dictates localized patient access. When a provider gets this kind of capital, they build. And 5,800 beds isn't just throwing a minor new wing onto an existing building. We are talking about the equivalent of building multiple, sprawling hospital complexes from the ground up to serve thousands upon thousands of new patients every single day. Now, this number 5 represents the highly accelerated timeline for this expansive rollout. Apollo Hospitals is executing this massive scale of expansion over just the next 5 years. Just think about that for a second. Adding nearly 6,000 beds to a healthcare network means securing land, navigating all the complex regulations, actually constructing specialized medical facilities, and then staffing them with highly trained professionals. To commit to doing the whole shebang within a tight 5-year window, that shows an incredibly aggressive and hyper-focused operational strategy. Section 1. Breaking down the revenue, the financial fuel. Pay close attention to that designation, Q1. This 7,043 core revenue figure we've been talking about, it wasn't generated over a decade or a 5-year plan or even a full year. This was achieved in just a single financial quarter, the first quarter of financial year 27. When a healthcare network can generate that volume of revenue in just a 3-month period, it creates this immense pool of immediate, liquid capital that can be deployed rapidly. It's the sheer velocity of this revenue that makes their ambitious physical expansion timeline even possible. Which naturally brings us to a vital question. Where does all this soaring revenue actually go? You know, it's really easy to get lost in the corporate spreadsheets just looking at quarterly earnings and profit margins all day. But in the healthcare industry, the real story is how you connect that boardroom success directly to tangible, real-world infrastructure. Because let's be real, if the money just sits in a bank account, it doesn't heal anyone. Section 2. Scaling up the capacity. The 5,800-bed blueprint. Visualizing this steady addition of 5,800 beds over a 5-year runway is incredibly important. They aren't just, waiting around and flipping a switch in year 5 to open everything at once. A phased timeline across year 1, 3, and 5 means localized patient access actually begins improving almost immediately as different phases of the project come online. Each milestone on this timeline represents brand new emergency rooms, new surgical theaters, and new intensive care units becoming available to communities that desperately need them. This perfectly illustrates the core dynamic we are analyzing today. On one side, you have the financial input, that massive Q1 FY27 revenue of 7,043 crore. And on the other side, the physical output, the addition of 5,800 new beds. By drawing a direct line between the financial input and the physical output, we clearly see exactly how corporate momentum translates into tangible patient capacity. The health of the business directly and immediately correlates to the volume of healthcare they can physically provide. Section 3, the future of Apollo, corporate growth and patient care. Okay, let's summarize our core takeaways here. First, we have that Q1 FY27 revenue surge of 7,043 crore. That's our financial catalyst. Second, we have a rapid 5-year infrastructure timeline, which shows just an unprecedented speed of execution. And third, the direct reinvestment into physical capacity, those 5,800 beds. What you should absolutely take away from this is that a specific corporate milestone on a financial ledger has a direct, profound impact on healthcare accessibility. More revenue in this context literally means more beds, and more beds mean more lives impacted. All of this leaves us with a pretty vital question to ponder. What does this rapid, corporate-funded expansion mean for the future landscape of patient care? When healthcare providers operate at this unprecedented scale, capable of funding their own sweeping infrastructural leaps in just 5 years through a single quarter of revenue, well, it completely shifts how we think about the future of medical access. Will this lightning-fast speed of expansion become the new industry standard? It is absolutely a fascinating trend to watch, and I hope this explainer helped you see the tangible, real-world infrastructure hidden right inside those soaring financial reports. Catch you next time.